Hi, my name is Megan Sohn, and today my presentation is Reduce Stress and Challenge Anxiety through EMDR. EMDR is a type of therapy that stands for eye movement desensitization and reprocessing. And I think the best way to explain EMDR is through a metaphor. So our body, if you think about it, has natural healing processes. Typically, if you get a wound, your body knows what it needs to do in order to heal. However, sometimes that wound can get infected, and that wound then needs to be cleaned out before the body can then resume its natural healing processes. So EMDR is essentially like that process where similarly there's an assumption that the brain has natural healing processes. The brain naturally, when we go through life, knows what information to take, how to process events that happen. But sometimes when something very stressful or traumatic or overwhelming happens, it's sort of like that wound getting infected, where essentially that memory of those events will get stuck in the brain, and it needs to be cleaned out in order for the brain to then resume its natural healing processes. So EMDR refers to that process of cleaning out the wound or the memories in the brain. And how EMDR does this is through thinking about whatever traumatic or difficult memory is stuck, while also doing some form of bilateral stimulation. So bilateral stimulation is stimulating alternate parts of the body, and there are different ways you can do this. One example is eye movement, so moving your eyes back and forth. There's tapping, so crossing your arms across your shoulder and alternating tapping. There's auditory ways where you can listen to headphones and hear an alternate sound, or holding a device called tappers where it alternates pulses between each. And the theory behind why we use bilateral stimulation while thinking about whatever difficult memory we're dealing with is bilateral stimulation is supposed to simulate what we do in REM sleep. In REM sleep, actually our eyes move back and forth quite quickly, and that's supposed to help process. So we process a lot of our lives actually when we are in REM sleep. And then I think bilateral stimulation also can help reduce the emotional intensity of events by having your focus in two places. You're thinking about, yes, the traumatic event, but also while doing tapping or while your eyes are moving, and that can help calm the body and brain while also grounding you in the present as you're thinking about the past. So the goal of all of this, the goal of EMDR, is essentially a couple-fold. So first, to help get memories that are stuck unstuck. So those memories that feel like they continue to really define who you are and your life and feel really consuming and activating. The idea is to get those memories unstuck, to reduce the emotional intensity around those memories, and then to help you reprocess in a more adaptive way, where maybe that memory used to cause you to feel some sort of negative belief about yourself. We want to reprocess that to a more adaptive belief. So another way of putting it is EMDR is about moving things, these traumatic memories, from feeling to fact. These felt experiences, instead of having them continue to be felt as strongly as they were once in the past, we move them to a place where it becomes part of your story, but it's just something that happens and it's no longer quite so defining. Thanks so much.